Hi guys, welcome back. This is your new prosthodontic lecture. We speak about post-insertion, adjustment, periodic recall, and checkup. So basically, this is a stage where you have given your dentures, completed final dentures have been provided to the patient, and then you send him, and then you recall the patient to check if there are any difficulties what he is coming across by using the new dentures. Usually most of the patients do have difficulties because one is they have to get acquainted or accustomed to the new dentures what you have provided. At the same time, there might be some fitting issues and some sore spots or any sharp edges on the denture which might have to be rectified. And we also speak about periodic recall, how frequently you have to recall the patient to check and do what necessary checkups do you have to do. So in this lecture, coming to your learning outcome, you will understand the post-denture insertion problem. So you will know at least 6 post-denture insertion problems. There are more, and you will be able to differentiate the errors which occur from occlusion or basal seat area. So you can differentiate where exactly the problem is situated, and also its management. How do you manage if a patient is complaining with a specific problem with the denture what you have provided. So first thing is introduction. Basically, post-insertion treatment is that phase of complete denture procedure that includes treatment and patient education. So you will have to do some kind of minor adjustments. As long as if your denture is not gone completely wrong, then you might have to repeat certain specific procedures, or you might have to completely redo the denture. The purpose of this is to provide the patient with a comfortable denture with maximum function so that he does not have any further irritations to his oral tissues, and also further educate the patient to successfully master them. So there are certain things you might have to tell him that he will have to get accustomed to these dentures what he is given. So in that way he gets adjusted and then he is happy with your dentures. We also speak about periodic recall and checkup. So firstly, when you are in the clinics, what are the instruments you need when you are going to start the treatment or when you're going to do a checkup for the patient? The mouth mirror as usual, and you have articulating paper and bite wax. So these are basically to check the occlusal errors, if there are any premature contacts or any change in vertical dimensions. Then you will need your articulating paper and bite wax to indicate what exactly has gone with the occlusal surface. Then you have grinding stones and acrylic burrs, that is if there are any sharp edges, then you will have to trim those edges. So you need these acrylic burrs to trim them and polish them as well. So polishing paste is also required. So once you have done any kind of adjustments using the acrylic burrs or the grinding stones, you will have to polish the denture and give back, because if you just trim them and give it back, they create rough surfaces, which is a site for the bacteria to actually adhere, or your calculus or your plaque to adhere there, and eventually lead to a site of bacterial growth. Then you have pressure indicating paste. There are certain times where the patient complains of pain in specific areas, but you do not see any inflammation or sore spots. So to identify these specific areas, you will have to use a pressure indicating paste. So you apply on the denture and you put it into the patient's mouth and you ask the patient to bite or do specific movements, and you will understand where the pressure or where the impingement of the denture is taking place. These pastes help you how to do it. So basically I will also explain how you go about with the pressure indicating paste in the further in the lecture as we go on. So first thing, when is the patient recalled? The patient is usually recalled after 24 hours, approximately after 24 hours. It can be between 1 to 3 days after your denture is being delivered. So it's always good that you do it after 24 hours, but in case sometimes patient does not come back to your appointment or needs a different appointment, it's best better you do it within the 3 days. And always remember to tell the patient before coming to the appointment that they have to wear their dentures for the next 24 hours and then come back. The reason being is, during this period, wherever the impingement or the pressure is taking place, these leave sore spots on the oral tissues, which makes it much easier for you to trim. if the patient is going to leave the dentures outside because he feels that there are certain areas where it is impinging and it is not possible for him to wear, if he leaves his dentures, these sore spots in the oral tissue heal, and then eventually you will not be able to find them and not correlate these sore spots on the impression surface of the denture and trim them. So it's always good that you tell the patient to wear it 24 hours prior before he comes to this checkup. Sometimes it might be very painful to the patient. In certain instances, you let him leave the dentures out, but before coming to the appointment, ask him to wear it for at least 12 hours and then come, so that it is easier for you to evaluate. Then the during this procedure, it is a very critical procedure because you are doing minor adjustments and eventually giving a final completely rectified denture where he can use it for the next few years. Probably for the next 5 years he can use these dentures without any problems. So that is the main goal in this treatment or in this appointment. Okay, so what you do is you gently ask the patient how is he getting along with the dentures, or has he got any sore spots, and always stick to the chief complaint what he gives to you. So if he says that he's got any kind of issues, biting issues, peeking issues, sore spots, ulcers, then you always rectify that particular problem for the patient. So it is very important that you closely listen to the patient, what exact problem is he giving, and correlate them and then rectify them. And once you rectify, you give it back to the patient and you ask him to try it out. So that should actually solve. If it doesn't solve, then you might have to recall him again in the later stages. So examination. So after you have listened to what complaint he is given, you have to examine. First thing, before you ask the patient to take out the dentures out, you observe for occlusion. Occlusion basically is simple. You ask the patient would be wearing the dentures, you guide the patient to occlusion. What you do is you can either ask him to bite by himself, or you could ask him, or you could guide it by yourself. So how do you guide it? You hold the lower denture with your two index fingers, that is your left and the right index finger, on the buccal flange. Place the thumb on the chin and push the mandible backwards slowly, and ask the patient to gently and very gently close the mouth. As he closes gently, you just try to push the mandible backwards and you see for occlusion. Sometimes what happens is there might be a premature contact, that is one of the tooth is coming in contact before they go into maximum intercuspation. So if you see that, that means to say there is a premature contact or there is a retruded contact position, and then it might glide into maximum intercuspation. So this is one of the error you do before you actually go into any of the other uh, problems. So once you see that, you will have to rectify this problem. So how do you rectify this problem? Either by selective grinding or grinding of those premature contacts, or you might have to redo the jaw relation, where you knock off all the posterior teeth of the lower denture, put a wax back, take a bite, registration, do your jaw relation back again, and then you rearrange and you re-deliver the lower dentures. So sometimes it can happen that uh, your teeth setting, or not your teeth setting, but your teeth arrangement might have gone wrong. So you might think that, okay, when I did the trial, the teeth arrangement was absolutely fine. I could see that there was maximum intercuspation, but now the patient is got a different bite. This usually happens is because when you are flasking and when you're doing the laboratory procedure, there might chances that there might be a small drift of your teeth, or drift of your teeth or one of the tooth. So when this happens, they might shift and the occlusion might change. So this can be rectified by selective grinding, as I said, or by redoing your jaw relation. And also, once you have done that, take out the dentures out of the mouth and then you do a thorough visual and digital examination. Digital is not the digital what you say, it's using your finger. So you run your finger on the entire oral cavity checking for any kind of inflammation, sore spot, redness, or pain. Where when you run the finger on, the patient might complain pain on a specific spot. If he does, that means to say they needs an adjustment in that specific area. Once you have checked for all that, you check for also the sides of the tongue and the cheeks, because this is basically sometimes the patient might be having cheek biting or tongue biting. So if this is the case, then you will also have to rectify. How do you do it? We will speak about it a little later. So post insertion adjustments, what do they include? They usually include problems associated with occlusal surface, impression surface, and polish surface. Now if you see on the figure, you would probably understand what is an occlusal surface. I assume you guys know what is an occlusal surface and impression and polish surface is, but in the figure you can see that the number 2, where the arrow is pointing towards the number 2, is the occlusal surface. Number 1 is the polished surface, and the other side, or the fitting surface of the denture, is your impression surface. So there are certain adjustments you will have to do relating to what problem the patient is giving you. So problems occurring following insertion and their solution. So there are certain factors. So we group it into three. First one, we speak about impression surface of the denture, that is your fitting surface of the denture. So basically patient comes up with painful ulcers, sore spots, inflammation, pain on insertion, sometimes painful on pressure. So if you put a pressure on, then the patient complains there is some kind of pain, and generalized pain over denture supporting area, pinching of tissues, and difficulty in swallowing. So how do you rectify is just run your finger on the impression or the fitting surface of the denture. If you find any sharp edges, sharp points, just round them off, trim them. So that will relieve. So if it is specific to any particular spot, correlate it to the denture where that impression surface is, and then you trim that so that you relieve that spot. If he's got pain on insertion, that is when he's inserting the denture or removing the denture, that means to say the denture is not relieved at a specific spot. You need to find where the specific spot is and then trim the fitting surface of the denture. Pain on pressure, overextensions. Sometimes if the flanges are overextended, when there is biting or any pressure, these flanges tend to push the sulcus surfaces and they cause an impinging on the surface. So this is basically extension. So you just remove the overextended. And next is generalized pain over denture supporting area. This can be used because of increased vertical dimension. So in this case, you will have to treat the increased vertical dimension. Pinching tissues is peripheral overextensions, and difficulty in swallowing can be because of increased vertical dimension or due to post-am is too deep. So if the post-am is too deep, it impinges on the postal palatal area. So you will have to round that post-am. So what treatments do you do? So first thing is, yes, as I said, trimming of the dentures by running the finger on the sharp edges, finding out where the sharp regions are, and then you slowly trim that and polish that area. You can also use pressure indicating pastes to find out where the pressures are being applied, where you cannot see any sore spot or inflammation, but the patient is complaining that there is some kind of impinging taking place in a specific spot. Correction of vertical dimension is selective grinding. So you use an articulating paper, check the point of contact, initial point of contact or premature contact, trim that area or trim that cusp. That is basically a selective grinding. There is also something called as Bull's law, which you can refer, and this is also a part of selective grinding. So you can do that. And also if this does not rectify, sometimes you might have to repeat your JR. JR is jaw relation. Now I will explain you how pressure indicating paste is basically used. So what you see on the figure, on the left upper figure, you see two boxes with two paint brushes. So the white color box is a pressure indicating paste. That's where the paste is, and the bottle what you see is a remover. That means when you apply the pressure indicating paste, it dries up, so you have to remove it. So you use the remover to remove this pressure indicating paste. If you see on the right side upper figure, you see how the pressure indicating paste is applied. you see that there is a constant streak which is applied from the front to the back. This is very, very important that you make one single streak from the top to the bottom. That is, the direction of the streak is only on one is the direction of the streak is always straight, like from the front to the back. Okay, you do not crisscross because it will give you a wrong reading when you are actually doing it, when you are actually using this pressure indicating paste. So that's how you apply it. So you have to apply a thin layer where you see a nice white coating which is quite thin, or which is also quite translucent, where you can see a slight uh, reddish color of the denture. If you see on the other side, you see insufficient material which is applied. That is, you still have applied, but you can see more of the denture and hardly any in pressure indicating paste. And excess is where you see a lot of paste being applied and you cannot see the denture. Okay, so this is how you apply your pressure indicating paste in a strict manner and uniform and constant. So now you see how once you have done this or you have applied it completely, you place it into the patient's mouth and ask the patient to bite. When the patient bites, you see that there are certain areas, you see into specific areas. So if the streaks are present, that means there is no contact. So that's why the streaks are not discontinued. If the paste is still present but the streaks are gone off, that means there is normal contact between the denture base and the mucosa or the oral tissue. And if you see that there is impingement, the entire paste would be dissipated from this area. You see that eye letter on the figure, you see that the entire denture is being exposed. That is a place where you have impingement. So this is how you find out where exact the pinching of the denture is taking place on the oral mucosa, and you trim that specific area. After you have trimmed it, you can still apply back the pressure indicating paste back up again and check for impingement. If there is still impingement taking place, then you might have to further trim it. If it is like no, if it is like there is a paste and no streak, that means to say it has been rectified and there is no impingement and there is a normal contact of the denture to the oral mucosa. So this is how you use your pressure indicating paste. Next, coming to list of factors resulting discomfort in the occlusal surfaces of the denture. So pain on eating, so anterior prematurity or posterior prematurity. I have explained what a premature contact is, and I also explained how to determine it or how to find out, and then you have to rectify this. Pain on the lingual to lower anterior ridge. That is basically if there is an overextension, or if there is an overextension, then you might have to trim that. It will relieve it. If not, then look for protrusive slide from RCP to ICP. So RCP is retruded contact position, that is your premature contact, and ICP is intercuspal position, that is maximum intercuspation. Okay, and pain and or inflammation of labial aspect of the lower ridge. So if no impression surface defect, so if there are any sharpness in that area, you might have to trim. If this is not seen, then there may be lack of incisal overjet causing incisal blocking. This is reason is because what is happening is the lower incisors are occluding onto the palatal surface of the upper incisors. So when that is happening, there is more forces acting on the upper denture at the anterior surface, and the flanges are putting more pressure onto the sulcus or onto the ridge area. So when this happens, you might have to rectify a uh, by giving the rectify by trimming the incisal edges so that there is no contact happening. And then you have pain about periphery of dentures, possibly accommodated by pain in masseter or posterior temporalis. This is one of the rare conditions which can happen. This is basically because there is the vertical dimension of occlusion more than the patient can tolerate. Then you have cheek or lip biting. For cheeks, likely that function width of the sulcus was not restored, and for lip biting, it is poor lip support or inadequate anterior horizontal overlap. Tongue biting, lack of lingual overjet, teeth generally placed lingually to the lower ridge. So what treatment you do is adjust of occlusion, selective grinding, or repeat of your jaw relation, register and reset the teeth, and then removal of the lower lingual cusps. So basically this is when there is cheek biting or your tongue biting happening. So basically it's more of your cheek biting. If the tongue biting is happening, then it's basically because of your teeth which are more lingually placed to the alveolar ridge. Next, coming to list of factors resulting in discomfort relating to polished surface of the surface of dentures. So pain on the posterior aspect of the upper denture on opening alone. That is the posterior portion of the flange of your buccal sulcus is actually impinging on something. What is it happening is the buccal aspect, the flange on the buccal aspect of the tuberosity is too thick, and this is impinging on the coronoid process. That is your coronoid process, which is on the mandible. So when the patient is opening, these flanges are touching those coronoid process and pinching the oral mucosa on top of it. So how do you treat it? Using uh, disclosing material or your pressure indicating paste. What you do is you apply in that posterior flange area, and then you ask the patient to open. So you would see that the impingement mark on where the paste would disappear. So there would be an impingement mark. So when that is happening, slowly trim it, and this will be rectified. Next, coming to is aesthetics. Aesthetics is very important for patient. So always remember, when you are doing the try-in, make sure the patient is happy with the aesthetics. That is the appearance, the teeth color, and the position of the teeth, because this can mentally and emotionally affect the patient. So very important that you correct this problem in the try-in stage. If you do not correct this problem, then the patient will complain once the denture is being done, and then you cannot rectify this, where you have to redo the denture or remove all the teeth and rearrange them. The next one is phonetics. Phonetics, what happens in patients is there might be alteration in speech when you give the new denture. The reason is because when the patient is holding or using the old dentures, these the patient is accustomed to these old dentures, so his speech is also modified to those old dentures, where there is wear and tear of these dentures. This wear and tear might be on the uh, occlusal surfaces, or they might be on the wear and tear might be on the teeth or on the polished surfaces. So when you give these new dentures, the dentures might be much thicker than the previous one, so he might have problems while speaking. There's no worry, but you can just ask the patient to speak loudly or read a paper loudly for a week, and then the patient gets accustomed to your new dentures what you have given, and then his speech rectifies by itself. Phonetics in relation to dentures is necessary in order to correct speech defects that may occur in denture wearers. Accurate design of complete dentures. Next, coming to recall appointments. When do you have to reschedule these appointments? When do you have to call the first recall is 1 to 3 days, usually 24 hours, but within 3 days. Second recall is 1 week after your first visit, and then the third day recall is 3 to 4 months after second visit, and maintenance is every 1 year. Usually patients who get satisfied with the dentures, they tend to not come back for your appointments. You can just gently ask them whether they're doing well. If all, then you did not recall them, or sometimes you might have to recall them and recheck every year. This is just to know whether their denture hygiene is good, and whether they're regularly brushing the dentures what you have given. If not, you might have to reinforce the uh, denture hygiene to the patient, which is very effective and also helps in certain problems. This is a general recall program which need to be modified depending on post-insertion problems after the first recall appointment. Sometimes there might be patients who might want a couple more week visits where they are not completely satisfied with the dentures. So in that cases, you might have to call them for a 3 consecutive week visits, and probably after that the patient might be happy. References, what I have done for these is identification of complete denture problems, a summary, which is from the British Dental Journals, which I have also shared it on Google Drive for you guys. And also you have the voucher, which is a textbook for prosthodontics, completely dentureless patients. These are the two references I've used to create this lecture. You can go through both these, and also you can also go through the laboratory procedures in vouchers, which is very well explained when you are doing the fabrication of the denture. Okay, thank you and have a nice day.